Welcome to Focus on Crestview. I'm Derek Lott, the President of the Crestview Area Chamber of Commerce and City President of CCB Community Bank. Today I'm proud to have North Okaloosa Medical Center, our sponsor for this month's breakfast, and David Fuller, our CEO, and Leanne Holcomb, which is the Director of the Cath Lab. I want to tell you guys thank you so much for sponsoring the Chamber breakfast and being part of our community. It's very important that we have the medical component of our community to be part of and involved in the Chamber so that people know what's going on at our best hospital that we have in the area.
Well, thank you, Derek. It's considered a privilege to be a part of the Chamber and to provide that sponsorship.
Well, I tell you what, you guys have a lot going on and you're growing like crazy. Last year when you were here, we talked about the new patient tower, and I know this time there's some new surprises that you have. We're going to talk about the Cath Lab, but before we do that, I wanted to congratulate you on a few things, and one of them was you guys were selected for the finest of the Emerald Coast.
And we were real excited about that. Our marketing director, chief nurse, and I had the occasion to go down a few weeks back to that celebration and receive that award on behalf of the hospital. But staff like Leanne and others that do a great job for us every day and do a good job for our patients, and we were really appreciative of the recognition.
Well, I know it makes you proud, and you got a good team there, and a lot of the doctors and nurses and the staff are very involved in the community, and we see them out in the community, and they're part of the town and part of North Okaloosa, and that's very important to a business to be integrated in the community.
Well, and you talk about being part of a community bank. That's what community hospitals are all about. Knowing your customers, knowing your people, knowing what their needs are, and so you can't know them unless you're out there with them. So we enjoy that.
Well, tell me a little bit about your staff and the people that you have involved, and some of the key players.
Well, we're real fortunate to have just a real collection of professionals. Lots of times in my career, I hear people talk about small community hospitals like Crestview, and I think, well, if you were really good, you'd be at some big institution somewhere. But what I've found through the years is that some of the collection of the highest skilled, highest trained folks are in community hospitals like ours, and because they want to be there, they choose to be there. We've had a real good year this last year with some of our physician recruiting, medical staff development to continue to expand the capabilities of the hospital and its services. So we just keep pumping away every day, trying to make sure we can improve what we do, and so far so good.
Well, let me ask you, you talked about services. Can you tell me a little bit about what services are offered at North Okaloosa Medical Center?
When I describe our hospital to our community, I tell them, that we're pretty much everything you need from a primary care specialty perspective with select medical specialties. Orthopedics, general surgery, our cardiovascular program, like what Leanne is with. So, we provide a pretty broad range spectrum of services. The only things we really don't provide, quite honestly, would be maybe the CV surgery component or neurosurgical components, which more times than not, those are most aptly provided in tertiary care providers like to some of our larger city neighbors.
And when you speak of larger city hospitals, what size hospital, by measurement, I guess you measure the hospital size by the bed?
Sure.
So what size is your hospital?
A hospital is licensed for 110 beds. Another measure oftentimes is your volume or your capacity of services that you provided. And we would nicely fit in kind of that mid-range size hospitals. When people think about hospitals, typically you have oftentimes the small community hospitals and then the tertiary care providers. And we're one of those strategically placed right in the middle size where we can really respond, have the resources we need to be able to respond to the needs of the community, but at the same time keep that hometown touch.
There's a huge benefit to that, same in banking too. Obviously the real big machines are sometimes hard to manage, and of course the smaller can't provide all those services and the things you really need. So being in that kind of middle niche class a lot of time is the best place to be in an industry.
Well, and I have to tell you, Derek, I find we are oftentimes held a little bit more accountable than what some of our bigger brethren are, in the fact that our bigger brethren don't go to the grocery store and get pegged by their customers. Leanne and our staff, if we don't do a good job, when you're out at the grocery store or at church somewhere, at the school, you're liable to, somebody's going to tug on you and say, excuse me a minute. So we are held to, I think, oftentimes a higher level of accountability because of that.
Or instant accountability.
Absolutely.
Well, what do you guys see as some of the health issues in our community, and what are y'all doing to help mitigate those?
Well, we're not unique in that every town likes to think it's unique, but from the standpoint of its healthcare, we're not that terribly unique. When you look at the nation, heart disease, cancer, some of those kind of things are major problems in our communities. But yet at the same time, those are the ones that get a lot of attention. The little things are also real important. The managing the hypertension and the diabetes and trying to be a part of the education in a community to help encourage people to be more responsible in managing those sort of things. That was really the reason why we ventured off into our cardiac program, because it's the #1 problem that we have in this country. And we felt like by being available to provide services as quick as possible to our community when they have a need is us doing our job. Anything less of that, quite honestly, you have to scratch your head and wonder, are we really doing what we ought to be doing?
Well, what other programs? I know we want to talk shortly about the new cath lab, but what's some of the other things you see on the horizon that the hospital is going to be involved in?
You know, our organization is kind of uniquely positioned right now. You know, our community is a growing community. A lot of hospitals around the country are in communities that are either contracting or kind of stable in nature. The beautiful part about being in a growing community is that you can continue to expand those services. You know, right now we just brought on a new orthopedic surgeon. For several years we've kind of been lacking in that service line, and so we begin to expand that. Long term, our desire is to have 3 full-time orthopedic surgeons in our market servicing those needs. In addition, there's a lot of medical specialties where we only have 1 physician. And while those physicians have done great jobs for us through the years, you know, quite candidly, our community is in need of a little bit more. So we're looking at those medical specialties, things like, you know, urology is a good example, or neurology, some pulmonology, some of those sort of services. The folks that are in those disciplines have done great jobs and continue to do great jobs for us every day, but oftentimes it's just not quite enough volume, capacity there to support the volume that we have a need for. So, you know, we're looking at how we expand those programs and services. Our stroke program, we started shortly before we did our cardiac program, and that's working really well for us. And obviously we need more support in areas of neurology and our relationship with tertiary care providers in Pensacola. We're very appreciative to help us support that program for, again, a quick response to those patients who have those stroke-like symptoms, because, you know, as we all know, again, time is of the essence in dealing with those sort of conditions.
Well, it sounds like you guys have a lot going on, and we have a lot to talk about, and I really want to hear about this new cath lab. So you guys stay tuned out there. When we come back, North Okaloosa Medical Center is going to tell us about the future they have with their new cath lab and some of the other things that they see coming on the horizon.